Hello people, welcome to Healthy Living Global. Please note, this is for educational purpose. This procedure may vary in different hospitals, but to avoid abscess, follow this procedure. After following this procedure, there is every 100% sure that, or 99.9% that you are going to avoid injection abscess. Alright, let us go. What we are talking about is how to give IM injection to avoid something like this. Right, let's go. Now, the reason why I have to come and give this lesson, this is a global platform where we need to do the needful thing or learn how to do the needful thing to avoid some common issues. All right, we can avoid one we're supposed to avoid. This case was brought to me and I have to talk about this. Let us not forget that the money they use in treating abscess is higher than ×4 of the money of which you may have spent in getting a good professional for this, or even what you have spent in treating your normal sickness or what you were having before going for this injection. Now, what is the goal of someone that is giving injection, administering injection? The goal is what? To make sure that you give the recommended dose and also give it as prescribed. There are some injections that are supposed to be given very slowly, right? That can take 5 minutes. There are some that is only 1 minute. Read the leaflet or follow the procedure. And also another goal of it is for you to make sure you did not give the patient injection abscess, and also you did not introduce infection to the injection site. Another goal also that is very funny is that you will try as much as possible not to transmit an infection or a disease from the patient to yourself, because if you are not careful, you putting back the needle in the cap and it pierces your hand, you know what it can result to. You know that many people have contracted HIV and other diseases through this. Be careful. All right, let's go now. Now, prepare your injection as recommended by the manufacturer. Okay, note that syringe have different parts. All right, there is now this is the needle, this is the needle inside, and this is the cap of the needle. This one I holding the medication itself is called barrel. All right, this is the plunger. This is the plunger. Now, if you prepare your injection, you can allow the patient to lie or stand. Right, you use your own head and draw an imaginary line. I'm going to show you in the little drawing. All right, guys, this is the practical example of what we are discussing. Let's assume this is buttocks. All right, don't laugh. If you laugh, it's at your own risk. Now you draw a vertical and horizontal line in each of the buttocks, all right, or any one of which you want to give. Okay, imaginary line. You don't need to go and bring marker to go and be marking. All right, so the goal of this is to make sure no blood vessel is injured. All right, now all these places of which I marked, there is